Is child hand, foot, and mouth disease the same as animal disease? Imagine a child with a fever, sore throat, and a rash of small blisters on their hands, feet, and inside their mouth. This is a common picture of hand, foot, and mouth disease, a viral illness mostly seen in young children. But does this mean it's related to animal diseases like foot and mouth disease? Not at all. These two conditions are completely different, caused by different viruses, and affect different groups of living beings. Hand, foot, and mouth disease is caused mainly by a virus called Coxsackie-virus A16, which is a type of non-polio enterovirus. It spreads easily through close contact, like when children share toys, or through droplets from coughing or sneezing. The symptoms usually include fever, sore throat, and painful mouth ulcers, along with a rash of small blisters on the palms of the hands and soles of the feet. It is very common in children under 10 years old and usually resolves on its own within a week or so. Good hygiene, like hand washing and cleaning toys, helps prevent its spread. In contrast, foot and mouth disease is a serious viral illness that affects animals with cloven hooves, such as cows, pigs, sheep, and goats. It is caused by a different virus called the foot and mouth disease virus. This disease is highly contagious among animals and can cause blisters in the mouth and on the feet, leading to lameness and loss of productivity. It is a major concern for farmers and the livestock industry because it can cause large economic losses. Importantly, foot and mouth disease does not usually infect humans, and when it does, symptoms are very mild, like a slight fever or small blisters, and it is extremely rare. Despite the similar names, these diseases are not related. Hand, foot, and mouth disease affects children and is caused by a virus that only infects humans. Foot and mouth disease affects animals and is caused by a different virus that mostly stays within the animal population. There is no evidence to suggest that hand, foot, and mouth disease can be transmitted from animals to humans or vice versa. Understanding this difference is important for proper disease management. Parents should focus on preventing hand, foot, and mouth disease through good hygiene and avoiding contact with infected children. Meanwhile, controlling foot and mouth disease involves strict quarantine measures, vaccination of livestock, and biosecurity practices in farming. In summary, although their names sound similar, child hand, foot, and mouth disease and animal foot and mouth disease are entirely separate illnesses caused by different viruses. Hand, foot, and mouth disease is a common childhood infection that usually gets better without special treatment, while foot and mouth disease is a serious animal disease with no direct impact on human health. Always consult healthcare professionals for accurate diagnosis and appropriate care, and remember that understanding the differences helps us protect both children and animals effectively.